occur in patients who have legitimate prescriptions. I believe somebody mentioned tonight the average age is 35 of these victims that are dying. We need to give people a safe alternative to pain medicine, and we found that in marijuana. It's a very effective pain reliever. And I know what I'm talking about because in 2013, I was diagnosed with stage 3 breast cancer. I went through 13 months of grueling treatment, and I had very severe bone pain. And at the time, I didn't know I could use medical marijuana for my pain, but after I went and I learned about it and said, oh my God, I started using it. I use it every day. I'm pain-free, and hopefully it's going to keep my cancer from coming back. In that study that was done at the Perelman School of Medicine, they did a study of deaths caused by opioid overdoses between 1999 and 2010. Results revealed that on average, the 13 states the laws were enacted than states without laws, indicating that the alternative treatment may be safer for patients suffering from chronic pain. What they found in that 10-year study in the 13 states where they had legal medical marijuana, they found a 24.8% drop in overdose deaths. In 2013, I believe 44,000 people died in this country of opioid overdoses. 25% of that is 10,000 people. Over a 10-year period, that's 100,000 lives. So we really need to, I've worked with the governor, I've been at the opioid work group meeting in Plymouth, I believe, District Attorney, I saw you there. And the governor understands that we need to get these dispensaries open, and it is an alternative. It's safe. No one's ever died from marijuana, ever. And you cannot, I've gone to talk to scientists at MIT and laboratory people, and they said that you cannot physically be addicted to it. And as far as having marijuana in the home, it needs to be treated around children like alcohol and prescription drugs and substances that are much more dangerous.
How successful have we been with alcohol and prescription drugs?
Well, alcohol and prescription drugs can kill you. Marijuana can't.
All right, well, thank you for that point. If you'd like, you want to send me a copy of that study, I'll email it to everybody on this particular...
I'm available to speak to any groups or any legislators or anyone who wants to learn about this.
Thank you. I'm going to ask nobody else to get in line because I do want to try and get you out by 9, and I want to promise you that the conversation does not end tonight. This is just the beginning. We will continue with more meetings like this.
My name is Danielle Boucher, and I'm a resident of Franklin, Mass. I have in my family 2 very close family members who are both addicts. And, you know, I really don't want to stir the pot or anything like that, but tonight you see firemen and you see police officers and people from Milford Hospital all sitting up here and talking about, you know, what the problems are and what they're going to, you know, do to change it and all these things. But in my experience, one person that's very close to me in the last 10 years has overdosed 7 times. And there has been multiple times where you call for help and an officer shows up and says, you know, I have much better things to be doing with my time. Or they'll bring your family member in to a hospital on an ambulance, and the whole time they'll sit there and put them down and say, do you realize what you're doing to your family? Do you realize, you know, what's going to happen later on today when you're not home? And you know, these things, I've heard it from officers, I've heard it from firemen. Then, you know, Milford Hospital talking about, you know, all the prescription drugs and all these things. My close relative who's been in there 7 times in 10 years, never once have they helped that person. Never once have they put them in a rehab. Never once have they done anything like that. And I mean, you can go to Milford Hospital and you can turn around and you can get Percocet for just about anything. I went in for a second-degree sunburn about a month ago, and they gave me Percocet. I refused it, but I didn't get an antibiotic. I didn't get any cream. I got Percocet. That's what I was offered. I went in for tooth pain about 6 months ago. I'm sorry, we don't deal with dental. Here's some Percocet, call your dentist. You can get them like candy. And when you sit here and you say, oh, lock up your medications, put them in a safe, whatever you want to do, let me tell you something, I'm sorry, but if you're an addict, and I'm sure you guys will agree with me, you're gonna find it. It doesn't matter if it's locked up in your house. You're gonna go to your dealer. And your dealer, 9 times out of 10, it's something ridiculous, like, oh, I went to Milford Hospital like 3 times in 1 month and said I had chronic back pain, so my doctor's prescribing me Percocet regularly now, and I just sell them.
Well, I want you to know that one of the things that is available to families who want to intervene under Section 35, they can petition the courts to have their family member
Sectioned.
But one of the things...
You want to know what happened when I did that?
One of the things that is part of the governor's task force recommendations is to make it easier, because I know what you're going to tell me, but it's not easy to get
They want to send her to prison for a week and then let her go.
But we are working on making it easier for families to get involved. And I understand your frustration. I'm sure everybody here on this panel understands the frustration. But this is what a community coalition is all about, trying to get these stories, understand what the problem is, and be proactive so that we can help people like your family member identify the resources and get the help that's needed. And you have to be a part of this team, as well as everybody else in this room.
I'm the one that always calls the ambulance. I'm the one that always gets them to the hospital. I'm the one that tries to section them. I'm the one that puts them in detox.
Don't give up. That's what I can tell you. Don't give up.
That's why I'm here.
Thank you.
My name is Jim McCusker. I live here in Franklin, and I'm the father of a heroin addict. And I agree with what was mentioned before. You know, this heroin addiction is right in line with mental addiction also. ADHD children, ADD children, bipolar children, heroin is a magnet to them. They have these mental conditions, and heroin just finds their way to them. You know, Chief Surgeon, I've been in your house. You guys are great. D.A. Morrissey, I've been in your house. I've attempted to use Section 35. I come in on a Friday knowing that she's pretty much close to death. I'm told, Jim, we appreciate it. You have to come back on Monday. The house is full. We understand that. As we heard before, the facilities, the facilities are extremely limited here in the state of Massachusetts. You know, I really feel for Bob when he wants to move his, you know, he wants to get to your house 2 more minutes. Well, the court tells me to come back on Monday. You know, I've been into Dr. Hopkins. I've been in your house too, many times. I go in, you guys are great. Riverside comes in, they talk to us. We don't have a place. We have to send her home again. My concern is, where do I go? You know, it's difficult as a parent to see this happen, to see them dying in front of me. What can I do? The systems are just not available here in the state of Massachusetts. Not available. And I'm asking heroin addicts, the phone call comes, what's your next step? You know, are you soon enough, as Bob says? Are you there quick enough? The courts haven't worked for me. The Section 35s are great. They give you, the judge gets up and they say, I'm going to give you 90 days. Everyone in this court knows you're lucky to get 15 or 16 days in there before you're released. And it all has to do with beds and availability. We understand. But we love this coalition. I'm here. But the state needs to realize we need more facilities. We need them. And unfortunately, it's great for tomorrow, but the people like myself and my daughter who I deal with, we're dealing with today.
Dr. Hopkins?
Yeah, I just want to make a quick comment. I think, what we hear over and over from families and from patients is the sense of frustration. We see it all the time in the emergency department. We will have patients that will come in, family members that will come in, parents that will come in and say, this is the opportunity. I have my loved one here with me who is addicted or just had a heroin overdose. And we at times feel as helpless as you do in these situations, and I totally agree. What's been said over and over here is that there are system issues to come into a hospital and ask for treatment when you're ready. You have that opportunity to treat someone, and it happens to be a Saturday night at 10 o'clock, and every bed is full, and the best you can offer is, well, you can stay overnight, but I can't guarantee you tomorrow that we get you into a rehab facility. I can understand that frustration. It's frustrating from a provider side, it's frustrating from a patient side, and we are, part of my reason for being here is because I see this every single day, and it affects tons of families, and it's not right. And the system does need to change, and I applaud all of you guys for bringing this up, because this is exactly what we need to hear so that we can change the system, so that we can get people efficient, effective access to those beds that they need. And
we call the rehab facilities. I'm a parent. I've got a 25, 26-year-old. I call. I say, I've got a 25, 26-year-old that wants to come in. We call multiple times. They tell you to call and call and call. We finally get to the right person, and they say, sorry, Mr. McCusker, your 25-year-old has to call. She calls. And as was said earlier, if you don't answer that first yes, they're very unlikely to give you the second. They won't go to their phone. Who knows what they're doing in the meantime.
I just wanted to, I hear this frustration all the time as a therapist and in the community. And I have to say that one of the best things that has happened in my experience is with American Addiction Centers. And one of the things that we have done, and with the Milford Hospital, is making that collateral phone call to me to say, we have a client who's in the ER who needs some substance abuse. Can you help us get him either in to see me, or he needs a detox or something? And we've been working with the Franklin Police Department, and I've had Lieutenant Drake, or Lee Drake has called me a bunch of times, and I've gotten people into detox through Peter and American Addictions. I don't even know who they are, but they've texted and we've gotten them right into.
Well, have these guys give me my card. Give me a card. I'm here.
And my card's right on the front, so I mean, we can make sure that American Addictions is there.
Come see me. I'll wait till.
It's been amazing. We've saved so many people, and I just can't say enough about how good it's worked.
Appreciate it. We greatly appreciate this.
The issue that you talk about on a Friday, ironically, just doesn't happen on a Friday, that's what I have to say. And we often use the court system to try to leverage people into treatment. But just so you know, not to tell any stories out of school, the largest detox facility in Norfolk County, do you know what that is, don't you? It's the House of Correction.
I know that.
And because
she's been there, she's been to WotC, she's been to MCI.
Because
sometimes you can get in more trouble going for rehab.
Well, again, finding beds, it's not obviously that we're unsympathetic, and I, for one, can tell you, I've lost a brother-in-law to substance abuse issues. I have a nephew who probably left the same facility in New Hampshire that they were at and heading to Portland. It's a lifelong fight with addiction. It's not going to be over in a short period of time. And when you heard one of the speakers say, what we really have is revolving door or spin dry. We get them to the point where, and then it kind of fall off the cliff. And so that long-term treatment, which I think the state is starting to recognize, and they're starting to spend the resources, but obviously they have to do more. Insurers have to do more. And 98% of us are insured in the Commonwealth. What do you think it costs not to put in the money into prevention and to put us into long-term hospitalization and other issues when we could deal with a lot of the issues where we get people treatment and keep them out of the hospitals and save a lot of money. So
Well, I've been to rehab facilities that I have Blue Cross Blue Shield. Okay, I have a nice insurance program. I go to some rehabs and they say, you know what? We don't know how to use private rehab. We only know how to use mass health. It's amazing. So yes, we appreciate the step, but it's the next step, and as I always say, it's the devil. It's in the details are in the devil. You know.
But you should know, be aware that the governor's task force has recommended and promised $27 million committed to getting more beds, and we in the legislature have tried to put as much money as possible into getting more beds, and we will continue to do so.
Jeff, thank you.
Let's move to this side of the room.
Hi, my name is Lisa Gately. Unfortunately, I know this problem all too well, but I am also very, very blessed. I know many people in my life that are in recovery and have been for years now. The thing that I have gotten from all of them, and I called them tonight to talk to them, to let them know I'd be here, is the first thing is an addict needs to want to be clean. We're talking about programs that we all want so desperately to get our children into, but the first step has to be coming from them. With that in mind, with what Mrs. Sevelinski said, we need help here in the town. We need a facility. If this problem is as bad as it sounds, and kids are dying, and I know so many people that have died this year alone, there has to be a place so that if I say tonight, I know an addict tonight that needs help, where am I supposed to go? I've been through this before. I've been through it. Thank God I'm not right now. But right now, if an addict needs help, I would love it if they could walk into the police station like they're doing in Gloucester. They walk in with their drugs. There's someone in that police station now walking them through every step they need to take. I think that is incredible. That's an immediate reaction. A drug addict who wants help needs help immediately. They can't be waiting, as we've all heard, days later. They'll pick up that needle again, and they will start using. And in this state, having to have an addict be actively using to get into detox is heartbreaking. I have to say, having to go through that is the worst thing I will ever go through in my life, and that nobody should ever go through. A parent, a grandparent, a teacher, and the community, again, needs to say, I'm asking tonight, if I were to call and say, I need help right now, what do I do? There's nothing that, this second, you can pick up the phone and you can start making those phone calls. I understand the frustration. There are programs, though. I know of programs that can help after the detox goes through. And because we all need that information, there's a place in Boston called Hope House. They're incredible. They will keep you in for a year. They will put you in a work program. You have to pay to live there. You take responsibility for your life again. As an addict, you have to become part of the community again. There's another program in Boston called Back on My Feet. They're incredible. They will give you running shoes. They will help you strive for something else outside of thinking of how horrible your life can be at times. I believe there has to be a more immediate, well, I can't think of the word, but I want to be able to walk into your police station if I know someone who needs that help with drugs on them and say, he wants to give it to you or she wants to give it to you. What can we do now? I realize that's asking a lot, but I am. I'm a member of this community, and I work hard, and I support all of you for what you're doing. But we've all seen too much heartbreak. We've all tried getting help, and we all need more help as a community.
Well, I'm going to let Amy take this because we've had this very conversation.
Yeah, one of the things, we had a small meeting prior to, I think the starting of this, and Officer Drake and I made a connection, and he has, I don't know if he's here, because I don't have my glasses on right now, but a lot of families have come in to the police station and have reached out and said, my son or daughter has a problem, what do I do? And fortunately, we have been able to get a lot of them a connection to me and then a connection to the American Addiction within days. So I know that that is something that is happening, or they've given, you know, my card and we've gotten them into therapy or somewhere else so that they can get those services. So I know the police department is doing that, and I don't want to speak for you guys, but I just know that that's the experience that I've had recently.
Well, I think if addicts can walk in without fear of repercussion, of getting arrested for having those drugs on them, if they're willing to give them up, I realize it's against the law. Don't get me wrong, I do.
I can tell you, these folks are committed to helping. Understand they're not going to arrest their way out of the problem. They are committed to helping.
That's
If
a
you,
wonderful thing.
and
I think we've come very far in the past, I'd say 4 years, and that is incredible. I do appreciate everything you've done. Hopefully there's going to be a more immediate, because I do know, looking around this room, when you're in this situation, the help can't wait. It just can't. They're closing facilities in Boston. We just closed a huge facility last year because it wasn't safe. Weymouth should be closed. There's a facility there that should be closed. It's disgusting on every level. We all need help. It's a community problem.
thank you very much. Right on this side. Did you want to say something?
I just wanted a quick comment on that. I've had a couple people that I've talked to that have gone to trying to get them into rehab, and they are afraid of getting arrested. That's why they do not go there. But I've also called Officer Brady again and Officer Copeland again, and they said the farthest thing we want from them is to we won't arrest them. We'd rather give them help. So, I mean, I've had a couple experiences like that. So, it's doing, like Officer Baker says, it's doing no good for me to arrest him. So, they do that.
So we're going to go to this side of the room, and ma'am, you're going to have the last word. Right here.
My name is James McCarthy. I graduated from Franklin High School. My son's about 45 days into rehab right now for his first time. And my frustration is the insurance industry and getting help with the insurance industry. People have talked about it earlier tonight. And every phone call you make, it's deaf ears. They don't want to help you out. And you as my state representative, we got to change this, because just like when I went to all the family counseling, they talk about this is a disease like heart disease, it's a disease like diabetes, it's the same thing, and they're not helping us out. And you would change that. And that's the only way we can do this. This is a disease. It's not something that we all be sticking our heads in the sand. This panel is great, and they talk about a lot of great things, but it's a disease. And if we don't treat it like a disease, then the insurance companies are not going to treat it like a disease, and we're not going to get the help that we need. And the phone calls, there's one woman that spoke earlier over here, and she was going to get better health care in California than she was in Massachusetts. That's bullshit, and we can't stand for that. And you as our representative have to change that, and that's the only way we can move forward. It's just so frustrating. I have great health care. My son and I are so fortunate that the health care that we have, that they're paying for everything. But I just can't sit here. It's like I'm on the phone, and they don't even want to talk to me because he's got a drug problem. This is not a drug problem. It's a disease, and it's a disease that we all have to face moving forward. And
Thank you, sir. Thank you. I have to say I'm with you 110%, but doing it without your assistance and your help and your collective wisdom is impossible. We need you. I can be your voice on Beacon Hill, but I need you to share these stories and share these examples. And
tell me where and when.
all right, thank you. Appreciate it. Tonight's the first conversation, and And this conversation is going to go on until we have reached a result that's saving lives here in the Commonwealth of Massachusetts, in Franklin, in Milford, and all the surrounding communities. Ma'am, you got the last word.
Well, I didn't want to have the last word.
It worked out that
My
way.
name is Diana Godfrey. I've lived in Franklin for about 10 years. Have been a human service advocate for most of my life. I have been saddened to watch how our country has really forgot about our people to a great degree. The drug addiction is a huge symptom of it. My family has been I've been touched personally, and I'm with a lot of people who all have been touched personally. The thing I want to know is also, I know the governor has committed to 27 million. How many beds does that approximately carry out? It's not very many with the epidemic. We do, and I want to encourage us all to be calling our legislators to put the pressure on the governor, because we do need some action quickly. We are more interested as a society in the state in locking people up and spending money incarcerating people, but not helping them. This is unacceptable to me. This has been unacceptable to me. I know I'm not the only one in here that this is unacceptable to. One good note I'll leave with the Franklin Police Department. I had to call for an incident at my house that was with alcohol abuse. An officer, Officer Smith, came to my house. Not all the officers in Franklin are eager to help people. But this officer, and I know you're doing a great job. Please, I'm not taking from that. However, this one Officer Smith was there to say, you meet me down and I will help you find a place to get into. Okay? So there's you know, there's practice. We can all talk all we want. We can have coalition. We can have this all the time. I've been in this system for a while now.